Thank you for your patience. Welcome to the MAPS Canada webinar series, Examining the Psychedelic Renaissance, Season 2. My name is Reverend Shannon Smedella, and I am your host for the series. We have a special sponsor that is sponsoring this episode. So this episode is brought to you by Spores Lab. So thank you very much, Spores Lab. We're beyond excited to bring to you Season 2, as we had an extremely potent and successful Season 1 full of amazing speakers, researchers, and of course, attendees like you. As you can see, we've expanded our speakers for this season to include over 25 doctors, researchers, luminaries, ministers, shamans, elders, activists, and much more. Each of these speakers and panels will be showing up to share their important information and their take on the psychedelic renaissance. So as you know, the proceeds from the webinar series go to fund important research. And if you would like additional information on that research, you can find it at mapscanada.org. So some housekeeping items for today. We're going to start out with a conversation with our special guests, Dennis Mckenna, Dr. Leanna Standish, and Dr. Victoria Hale. After that, we will have a question and answer session. So make sure and vote up your questions. I see we already have 2 in the questions there. And also make sure and let us know where you're joining in from. We have people from Colorado. We have Ontario. We have, where else? Make sure and put it in the chat here. Let us know where you're from. Seattle. We have BC, of course, Vancouver, more from Ontario, Whistler, Nova Scotia, Edmonton, Waterloo. So yes, Philadelphia. Make sure and let us know where you're joining in from in the chat, and feel free to have a discussion in the chat there as well. So hi to everyone out there. It's definitely going to be a great episode today. So without any further ado, I'd like to introduce to you our speakers. So first up, we have Dr. Dennis Mckenna. Dennis Mckenna's research has focused on the interdisciplinary study of Amazonian ethnopharmacology. He has conducted extensive ethnobotanical fieldwork in the Peruvian Amazon. His doctoral research at the University of British Columbia in 1984 focused on the ethnopharmacology of ayahuasca and ukuhi, 2 tryptamine-based hallucinogens used by indigenous peoples in the Northwest Amazon. He's the founding board member of the Heifer Research Institute and was a key organizer and participant in the Ayahuasca Project, the first biomedical investigation of ayahuasca. He's the younger brother of Terence Mckenna. From 2000 to 2017, he taught courses on ethnopharmacology and plants in human affairs in the Center for Spirituality and Healing at the University of Minnesota. In 2019, in collaboration with colleagues, he incorporated a new nonprofit, the Mckenna Academy of Natural Philosophy. He emigrated to Canada in the spring of 2019, together with his wife Sheila, and now resides in Abbotsford, BC. Leanna Standish ND, PhD, is CEO of Sacred Medicines, PBC. She is a research neuroscientist and physician living and working in Seattle. She has held faculty appointments at the University of Washington School of Medicine, School of Public Health. She is professor at Bastyr University and co-director at the Advanced Integrative Medicine Science, AIMS Institute in Seattle, where the phase 1 trial of ayahuascas will be conducted. Victoria Hale, PhD, is co-CEO of Sacred Medicines, PBC. Dr. Hale founded the nonprofit pharmaceutical company, the Institute for One World Health in San Francisco, California, in 2000 and was its chairman and CEO. She then went on to found Medicines 360, a nonprofit pharmaceutical company dedicated to developing medicines for women and children, including pregnant women. She received the MacArthur Genius Award in 2006. She is also a MAPS board member. So today, in this episode, we will explore some of the following questions regarding ayahuasca-assisted therapy in the U.S. Should Western scientists and clinicians have access to the sacred medicine called ayahuasca? Is this cultural misappropriation? Is it appropriate to seek FDA approval of ayahuasca-assisted therapy? Is it possible to meet the FDA requirements for chemistry, safety, and efficacy? What is the best method of ayahuasca therapy? How might ayahuasca therapy someday become approved by Medicare? How can the sacred and scientific be entangled? Who is qualified to conduct an ayahuasca circle? How can and should this work be funded? How can Indigenous and Western scientists understand each other's ontology? How can authentic reciprocity be established between the drug companies that are making sacred medicines for secular use in the Indigenous South American Amazonian tribes that have given the world ayahuasca? why not Ayahuasca? Please help me welcome Dr. Dennis Mckenna.
Well, thank you. Thank you, Shannon. Thank you so much for that introduction. It's a pleasure to join you all today, and I appreciate your inviting me to these seminars, especially this episode. I think we're going to grapple with some pretty important issues.
Mm-hmm.
I think you got the long form of my introduction, so that occupied about a third of the time we have left. I'm going to have to cut that down. But anyway, it is a pleasure to be here to see so many of you. There's obviously intense interest in this topic. So I guess I can use my 10 or 15 minutes to kind of place it into context in terms of my own interests and concerns. I've been, most of you know who I am, been very active and involved in psychedelics since the late 60s. My brother, Terence Mckenna, led me down the primrose path at an early age, and I've never looked back. And ayahuasca has been a subject of intense personal and professional interest for many years. I went to my first encounter with ayahuasca as an ethnobotanist, as an ethnopharmacologist, was when I went to Peru in 1981. I was a graduate student at the University of British Columbia, working under Dr. Neil Towers in the botany department. And Neil was one of those people who was kind of the best mentor you could ask for. Very encouraging of his students to find their own path. Sometimes I was frustrated, but usually he was just there for us, and he encouraged us to create our own vision. So one day, after I'd been there for about a year, and I was having some trouble, I was actually initially going to work on psilocybin, Psilocybe cubensis, biosynthetic enzymes. But I was really struggling with fungal genetics, which is a bear of a course to understand. And I was getting frustrated, and I came into Neil's office one day and he said, well, I've got a little extra money in the grant this year. How do you feel about going to Peru? And I said, yeah, my bags are packed. When do we leave? And so I shifted the course of my studies from psilocybin at that time to ayahuasca. And as my biography that Shannon so kindly read, I ended up working on a sort of a comparative study between ayahuasca and another, which everyone knows about. It comes from many different indigenous cultural contexts. And in comparison with another very obscure one that nobody knows about, few people know about, called ukuhe, which is another orally active DMT-based psychedelics used primarily by the Witoto and related tribes, and it is dying knowledge. That tradition was never very widespread, unlike ayahuasca. So I ended up doing my thesis work on a comparative study and mostly focusing on ayahuasca. Not so much the anthropological side. I was interested in the ethnobotany, the chemistry, and the pharmacology of ayahuasca. And that's what I ended up doing my thesis work on. And then once I got my thesis, I spent a couple of years, actually more than a couple of years. When you have a PhD in psychedelics, there's not a lot of job opportunities, or at least there weren't back in the 1984. So I had to kind of cobble together different postdocs. I ended up doing a postdoc in the Laboratory of Clinical Pharmacology at NIMH for 2 years, and then followed that up at Stanford with another postdoc eventually joined Shaman Pharmaceuticals in 1990, which was a startup pharmaceutical company. You can tell from the name that it was basically directed toward ethnobotany-driven drug discovery, and it seemed like a dream job at the time. I mean, it was a dream come true. Like all corporate entanglements, it didn't really live up to its promise, but I was there for a few years, and during that period, I did maybe the second phase of my long association with ayahuasca. I worked on ayahuasca during graduate school from 81 to 84. Then I sort of took this detour into neuroscience, still working on psychedelics, in this case on psychedelic receptors in the brain. And then Shaman Pharmaceuticals was a chance to get back to the natural products. During that period, I was able to organize what's come to be called the Ayahuasca study. And it was basically a biomedical study of ayahuasca, working with the UDV, one of the syncretic churches in Brazil. I was invited, along with other ayahuasca researchers, anthropologists, chemists, botanists, and so on, to a conference that they had organized in 1991, where we just presented our information, and I had my thesis work to talk about. But then it turned out their real agenda was to, they wanted outside investigators to come in and do a biomedical study with ayahuasca because it was under threat. The Brazilian regulatory agency, CONFEN, which is kind of a cross between the FDA and the DEA, was considering whether ayahuasca should be banned. They were wondering, is this a public health menace, or is this medicine fairly benign? So the UDV wanted data, and they wanted data that was not tainted. So they brought in outside investigators and presented this idea at the conference. And I went back and I was able to cobble some money together and some colleagues, and we went back in 1993 and conducted that study with ayahuasca and volunteers of the UDV in the city of Manaus, which is the site of UDV's operations at their oldest temple, they call the Núcleo Calpari. And Dr. Charles Grove joined our group as a principal investigator. Jace Calloway did much of the biochemical work. And out of that study, we got about 8 peer-reviewed papers pointing to the therapeutic potential of ayahuasca. Now, it was not a clinical study. There was no controls. It was purely an observational study. The volunteers from the UDV allowed us to poke and prod them, take blood samples, and perhaps more importantly, interview them, conduct these very in-depth, psychiatrically structured life story interviews. And most of the volunteers, in fact, virtually all of the volunteers at the time, felt that the ayahuasca was what had changed their life. They felt that they joined the UDV, usually because a friend had recommended it, and they joined it at a time in their lives that was, of crisis, either domestic violence or drug abuse, most frequently alcoholism. And stories that they tell all had something in common, which was that they felt that within the supportive social context provided by the UDV and taking the medicine, the ayahuasca medicine under these circumstances, they were able to turn their lives around. They were in a state of existential crisis, and they felt that ayahuasca saved them. And we were able, to a certain degree, we were able to document that, both on a anthropological level in terms of their life stories, but then also biochemically. For example, we found, very unexpected finding, we found that ayahuasca apparently upregulates, that it increases the abundance of the serotonin transporters. And, I'm not going to go into details on that, but we felt that this was perhaps linked to its long-term antidepressant effects, because in the literature we found various pathologies related to pathological deficits in these transporters. Apparently, ayahuasca reversed this process. And at the time, it was the only medicine known to do that, which was quite interesting. And that was something that we always wanted to follow up on with a more structured clinical study. And really, this was the late 90s that we sort of completed the cycle of the research that came out of that 1993 studies. And for a long time, I thought, well, I was interested in conducting a clinical study with ayahuasca, but the challenges seemed rather daunting. Ayahuasca is quintessentially a plant. It's hard to bring it into a structured clinical study of the type that you might file an IND for, as Dr. Standish has done. And I met Dr. Standish about 2000. We became very good friends and discovered that we had this mutual interest in ayahuasca. And I had thought about applying for an IND, an investigational new drug application, but it just seemed impossible to fit something like ayahuasca into that framework. And in discussions with Leanna, I told her of my misgivings, and she said, well, maybe I'll apply for an IND. And I said, well, good luck. You're never going to get it. Well, I have eaten a large plate of crow over that, because she said, well, I'll show you. I will apply and I will get it. And she got it. Now that she has it is what this discussion is going to revolve around. So, just to complete my story, I did this work, and from about 2012 to the present, I started organizing ayahuasca retreats, some in the States and most in South America, and inviting people to come down to a place in the Sacred Valley of Peru. Very nice place that we have done these things called Wilcatica. And I've seen for myself the healing and therapeutic effects of ayahuasca. The people that come to our retreats are human beings like everybody else in a state of existential crisis, often with depression or addiction or trauma, other issues, the reasons that people seek out ayahuasca therapy or psychedelic therapy in general. And I've seen people, benefit from that. And really, it's transformed their lives. At the same time, during this period from really the early 2000s up to the present, I've watched this phenomenon of ayahuasca tourism take shape. And by organizing retreats, of course, I've participated in that. If ayahuasca tourism is a problem, then I'm part of the problem. But as I look at the situation and as I've seen it evolve, I've begun to realize that, the world needs this medicine in a certain sense. It's really a medicine not only for individuals, it's a medicine for the soul. It's a medicine for societies. Really, it's a medicine for our planet. We need healing on all levels. But the question is, it's also an indigenous medicine. It's not owned by any one indigenous groups, but as in general, indigenous people have been the stewards of this medicine. And so it is in a problematic position. What do you do when the West comes in and says, well, we're going to open a retreat center, and have indigenous shamans, but they won't be in charge of the retreat center. They'll be essentially employees. Most of the people that do this are fine with that. It just presents a host of problems in some ways from an ethical angle. So, and now, when Ayahuasca Tourism started out in the mid-90s, it wasn't a big deal. There were a few people that sought out the medicine in Iquitos and other places, but it's grown over time. And as the number of people who go to Peru to seek this medicine do increase, some of the negative aspects, you could say, have become apparent. Exploitation of indigenous people, the economic impact of extranjeros, gringos coming down. This disrupts their society in some ways, and at the same time, it affects their tradition, because, like good entrepreneurs everywhere, they're going to respond to what the customer wants. And if all of these people not from Peru are coming down to experience ayahuasca, they're going to make an effort to provide them what they want. And that is going to change the way the practice is done. This is not necessarily a bad thing. I'm not condemning any of this. I'm just saying that it's complicated. And yet at the same time, I think those of us in this seminar, and those of us with experience with ayahuasca particularly, feel that this medicine is too important to not share with the world. But how do we find the right context to share it with the world? How do we do this in a way that, respects the indigenous tradition, is able to ensure the sustainability of the plants, which are now over-harvested and under a lot of threat? How do we bring all these things together? How do we bring ayahuasca and shamanic traditions, traditional practices, together with biomedicine and psychotherapy? There is a possibility to create a fusion here, to create a hybrid between those that combines the best of both practices. I'm not sure, it's a very complicated thing. So I just want to mention in passing, and you can, you can look it up later, but in an effort to grapple with some of these questions, I started this nonprofit called the Mckenna Academy. Spell it. It's in the text box, the Mckenna Academy of Natural Philosophy. And the Mckenna Academy is basically a think tank, or it's a place for learning. It's a way to come together, to bring groups of like-minded people together to learn about plant medicines and everything relevant to that. And of course, because ayahuasca permeates much of our lives and psychedelics are so important to it, it basically relates to everything. So I hope that you'll check out the Mckenna Academy and see what we're up to. We have a seminar, 2-day seminar coming up later in October called Symbiosis, Ripples of Change. And I think it will be a very interesting seminar that will interest a lot of you. So take a look at that at our upcoming events and learn more about what we're up to. And I think I've probably gone over my time, so I'll let one of my colleagues take the floor. So thank you.
Hi again, Dennis. Thank you so much for sharing that. And those are definitely some very important questions that do need to be discussed. And we're going to invite on Leanna and Victoria. So if they are around, they're going to be sharing a presentation here, a slideshow. And then after that, we'll all reconvene and have a little bit of a discussion on that as well. So we have Dr. Victoria Hale here and Dr. Leanna Standish. So welcome to both of you. Thank you for being here with us today.
Oh, thank you. I'm so happy to be here with MAPS Canada, with all the people listening in. And I want to start by telling you how I met Dennis, which was in 1999 at a retreat. And the reason I went to that retreat is, as a neuroscientist, I've always been fascinated in what is consciousness and the mind-body problem. And I heard a lecture by Dr. Luis Eduardo Luna at a consciousness science conference at the University of Arizona. And I was so enthralled with the idea of ayahuasca and its effects on consciousness that I wanted to know everything about it. So I signed up for a seminar, and I had my first experience of ayahuasca in a ceremony that was led by Dr. Luna, and Dennis was there as an educator. And at that time, I had my first, what I call, awakening experience. And so that set me on the path of seeing if it would be possible to share ayahuasca medicine with as many people as we possibly could. So as a clinical researcher and scientist, I gave myself the task of bringing ayahuasca to America. And I was very naive then, and I thought, how hard can this be? And unfortunately, I was very naive, because if I had actually known what it would take, because we're now on the 21st year of this journey, I probably never would have started. But because I started, and then in 2018 I met Dr. Hale, what I'd like to do is to show you just a few slides that will show you kind of what we're up to, and pretty pictures. And then we can break. Dr. Hale will join as we go along. Then we can break for questions. So I am now going to share my screen. And I believe everybody can see something that says, "Why Ayahuasca Tea?" And is that true?
Yes, it's up
there. Okay, great. Okay, so here's what Dr. Hale and I have been working together to figure out a way to be able to do ayahuasca human research and also human clinical trials in the United States that are legal. So our purpose is to try to mainstream ayahuasca tea as a group therapy medicine and administered by ayahuasca healers. And so our idea is to take the ayahuasca as a botanical drug through the through the FDA, and also, as we're doing this, is to develop reciprocity programs with the indigenous peoples that are the source of this incredible scientific technology and wisdom. So I want to tell you the first step when I started this 20 years ago, having met Dennis, who's been a wonderful mentor to me over these years. And then Terrence McKenna had recently died, and so when I met Dennis, I had never met Terrence, but I eventually became the steward of the botanical preserve that Terrence and Dennis and Kat Harrison and Luis Luna had set up on one of the islands in Hawaii. And we have been educated by ayahuasca healers, both indigenous and also more Western trained. So one of the things that I started off with many years ago was to figure out what is in ayahuasca. So I collected teas from South America ceremonies and North American ceremonies. And what I found out was fascinating is that no matter where these teas came from, no matter what the tradition was, the amount of dimethyltryptamine in those ayahuasca teas was almost identical. That really surprised me. So that set off, the science of how do you measure and how do you make a standardized tea based on at least two of the active constituents that are well known, dimethyltryptamine and of course harmine, for those of you who know. So the step two was to learn about the plants, protect the plants, put the plants front and center. And so eventually I became the steward of Terrence McKenna's beautiful property and his house that he designed that you can see in this slide. So the plants for this IND, hopefully approved by the FDA, ayahuasca tea, is coming directly from this property, and there's just such beauty for me in that fact. These vines and the bushes, the psychotria bushes, were planted more than 40 years ago by these pioneers, and here are some photographs from the preserve on the Big Island. This is the Psychotria viridis on the left, and then cross sections of the vine on the right. And Dennis wisely, way back in the early 1980s, got these things, these plants vouchered, which is very important. Then the next step was to figure out how to make ayahuasca in the laboratory and to produce ayahuasca tea that is potent and free of contaminants and stable. So the next step was to submit a Food and Drug Administration investigational new drug application, and that's what it actually looks like. It's a huge document, and we proposed to do a very simple phase 1 trial with 12 healthy adults just to make sure that this ayahuasca tea is safe. And then the next step was to set up Ames Institute in Seattle so that we would have a clinic where we could do psychedelic medicine research, and Dr. Sunil Agrawal and I set this up in 2018, and these are photographs from our clinic, which is in the downtown biotech corridor in Seattle. It's a lovely clinic. And then the next step was to very carefully, delicately, thoughtfully develop reciprocity ideas. And I actually wanted to turn to Dr. Hale to talk about this.
Sure. Thank you, Leanna. We are spending a lot of time and energy exploring, listening, asking what a reciprocity program should look like involving a company that is developing ayahuasca. So there are 3 aspects to this. I'm sure we will add more later. But first, we have heard earlier about the potential over-harvesting of ayahuasca, either the vine or the leaves. So developing sustainable agricultural programs is very important. So Leanna described the Big Island program, and we will explore as well whether more of that is needed in the Amazon. Secondly, affordable and accessible medicine is extremely important to us, and we formed Sacred Medicines to be a public benefit corporation. This is a MAPS Canada event. I'm on the board of MAPS, and I think everyone knows that MAPS US is a 501c3 public charity, and it spun out a wholly owned for-profit public benefit corporation where mission is really a huge part of that entity. So we have a very similar structure to MAPS's MPPC. And then thirdly, the formal reciprocity programs are with indigenous communities that we are just beginning to meet at this time. Initial discussions have been about COVID, actually, the coronavirus, and helping these communities with food security. Traveling to markets to buy food has led to bringing the coronavirus back into communities. So something as basic as food security comes up. Also, economic development comes up. Sometimes it's a better water filtration system, and other times it has to do with education. So one of our big learnings is to not bring forward a program that makes us feel good, that makes sense to us, that logically fits with our company, but instead to actually ask communities where these medicines have been developed. That first, this begins with trust. So who are we? What is this about? What are we doing with this precious medicine? And then how can we engage in a reciprocal relationship? And I will say that giving cash is not the way to go, okay? It's what we think about in the West, but there is a much deeper multi-level program and initiative that we're going to develop. Programs, plural.
Well, thanks. I think this is the last slide, and I want to once again thank MAPS for being a fiscal sponsor. MAPS is accepting donations for this project. And we're also, as a public benefit corporation, we're looking for what are called impact investors. We're not interested in big venture capital. We're interested in people who want to support this mission and also want to get a bit of return on it over time. I just am so grateful to all of you. Thank you so much for listening in. And if you want to contact either Victoria or myself, here's our direct email addresses. And back to you, Shannon.
Thank you so much, ladies. It's wonderful to have you here and learn about this new work that you're doing. So I believe we're going to invite Dennis back on screen and have a little bit of a conversation with the three of you, and then we'll eventually hop over to our Q&A because I see we have a few questions from the audience so far. So if our tech team is there, if we could get Dennis back on the screen there, that would be absolutely wonderful.
Okay, here we are. Good.
There we are. So welcome back, Dennis, and thank you again all for being here today. So did you maybe want to start the conversation in regards to all of these big questions that we have here today?
Yes, I guess I can lead off. So thank you, Leanna and Victoria. Victoria, I haven't had the pleasure of meeting you in person, but it's great to see you. And I knew a little bit about One World Pharmaceuticals. I didn't realize that you were involved in that, but good for you. I always thought that was the right model.
Let me tell you as well, we tried to bring Dragon's Blood, which was Shaman Pharmaceuticals' first product, into One World Health and funded through the Gates Foundation. It didn't work. So we have connections on several levels.
Okay, well, very good to hear it. I always thought that if you're going to be a pharmaceutical company, try to do that with some of these indigenous medicines, particularly the sacred medicine. The nonprofit route is the way to go, so then you just take the profit motive out of it. And I'm sure you're familiar with the current ferment of new venture capital that's coming in and new startups, most of which is directed towards psilocybin. Ayahuasca is a much tougher one to approach that way because it's quintessentially a plant, or a combination of plants. You can isolate, you can make what's called pharmahuasca, as you know, which is a combination of synthetic dimethyltryptamine and beta-carbolines. It works, no doubt about it. It's not ayahuasca. It really is quite different than ayahuasca in its effects. And it may have application on its own. Let me just share, thank both of you for a wonderful presentation. I get what you're trying to do, and let me just share with you personally kind of where I'm at with this. This has been a point of view that has evolved over time, because when we finished this biomedical study, well, it never really is finished, but when we kind of closed it up, we published 8 peer-reviewed papers out of the study, and then I got very interested in trying to do an IND, thinking that, well, that's the next stage, that's what you do. And I never really got very far. As I mentioned before, I gave up, and Leanna sort of took up the gauntlet and said, well, I'll apply for an IND. And, and good for you. She did it and she got it, which totally amazed me. I just didn't think it would happen. But now that you've got it, the question is, what do you do with it? And I think it's a good thing. I'm a believer in science, but I think we have to be wary of getting in bed too far with the pharmaceutical company model. And I don't for a minute say that that's what you want to do. But my own view of ayahuasca and a lot of these things, but particularly ayahuasca, has evolved over the last few years. And I now I actually think these plant medicines should be as lightly regulated as possible. In fact, they should not be regulated at all, except from a standpoint of safety and purity and those sorts of things. They should certainly not be illegal. I throw it out there as a fundamental, sort of claim that I'm saying is that all organisms have a right to symbiosis, and no organism should be illegal in and of itself. I mean, we do not have the moral authority as the human race. We don't have the moral authority to declare that some species should be eradicated from the earth. If any species should be eradicated, it's probably us, because we're the ones who are causing all the problems, not advocating that. But I think you see where I'm going. So I've gone from a place of feeling that we should maybe try and develop we conducted this biomedical study in the 90s. It wasn't a clinical study. What it did do was yield a number of questions, particularly about these long-term neuromodulatory effects on serotonin, that would be very interesting to address in a well-constructed, double-blind, placebo-controlled study, because I think we feel that these long-term effects on the serotonin transporters is really at the heart of the long-lasting therapeutic effects of ayahuasca. You can only really approach that in a well-designed placebo-controlled trial, and so I think that's the rationale, behind. I don't know exactly all the details of the protocol, but I think that's the rationale, to try to investigate these sorts of things. The question is, what are the unintended consequences of bringing ayahuasca into the FDA regulatory framework? Is this something that we want to do? What are the pros of that? What are the cons of that? And since you and Victoria, Leanna, have been working so hard and so long on this IND, you've thought about all these things, these issues, and they're complicated. So I wonder if you could talk about that.
Well, I'm going to let Dr. Hale speak at length, but I do want to say this. My original impetus for filing with the FDA was so that I, as a neuroscientist, could study the effects of ayahuasca on the default mode network in the human brain using functional magnetic resonance imaging. In order to do any kind of research, I mean, probably anywhere in the world, but especially in the United States, you have to have an IND. I totally agree. These medicines should be decriminalized, and they probably will. Nevertheless, there will still be a place for standardized, excellent, potent ayahuasca for clinicians and researchers, and I'll turn to Victoria.
Sure. So I just made quick notes of 6 points for you, Dennis.
Okay.
The first goes to Leanna's point of having a standardized formulation. So how do you define a standardized formulation? FDA knows how to do that, and we trust that pathway. So having that standardized formulation so the studies can be compared that use this for both researchers, clinical trials, and hopefully eventually to be commercialized and available. Secondly, we believe it's very important to educate physicians in the Western medical and healthcare systems. And again, a great way to do that is by taking it through the FDA. Legalization of ayahuasca, it's a very powerful two medicines, whole plants, right, that are together without that background of information that has been vetted through an organization like FDA, which we think could be potentially problematic. Thirdly, we want to take it through, and we've been approached by scientists who believe ayahuasca and the microbiome are connected, right? We have whole plants, 2 of them. None of the other medicines that are being developed through FDA are like that. So we think that is extremely important, and we'd like to explore that with the FDA. We don't want it to complicate any approval for a psychiatric indication, but that's our intention. We are developing this molecule, this compound, no, neither of those are correct. This medicine, right, ayahuasca, these 2 plants, through the botanical drug development pathway. And Shaman Pharmaceuticals did the same thing with an extract of dragon's blood called crofelemer. So exploring the botanical drug development pathway is highly significant because, Leanna's career is in natural medicines and plant medicines, as has yours been. And let's open up. FDA has only ever approved 2 botanical medicines. I worked at FDA for 5 years after my PhD, okay? So FDA in itself is not always an obstacle. It actually can be that there isn't enough experience or enough organizations or entities that come through to create the foundation for what is a botanical drug and how much regulation should be required. So showing up with botanical medicines means you can partner with the FDA to carry these through. In addition, we want to validate the group administration of ayahuasca. So that's point number 5, okay? And the other medicines so far are going through with single patient medicines, although by the time we are finished, some of them may be finished as secondary applications or uses. And then lastly, we want to carry through as well with ayahuasca healers or shaman. How we're going to do that exactly and what the qualifications are, we're not sure. But when you bring forward a botanical medicine with hundreds or perhaps thousands of years of use, and you convince FDA that if there is anyone on the planet who is an expert with the use of these medicines, how to decide who should use them, who should not, what can go wrong, how much medicine isn't enough or should be dosed, it's these individuals. So bringing these individuals out of respect and honor, right, into clinical trials is something we are working on, and we do not know how to do it yet.
Okay. Well, thank you for that. I can see all sorts of reasons to have a standardized preparation of ayahuasca, because you can't, just from a standpoint of, how you integrate it into a clinical study, you have to have a standardized preparation. And with ayahuasca, there's not an option to have a pure compound as there is with psilocybin. And I know with your experience with the FDA, you know that it's not comfortable with plant preparations. There is a framework for it, but they love pure compounds. They're much more into that. So right there, you have a challenge. A couple of things I wonder worth talking about. There are any number of herbal products companies that investigate plant medicines. They develop standardized extracts. They carry out clinical studies. They're not under any FDA regulation. They just do it because it is good practice and it supports, their products to be able to make these claims that they've clinically evaluated them. Why do you have to do this under an FDA framework?
Well, it's the DMT. It's the Schedule 1 nature of ayahuasca, and it brings in the DEA. I'll tell you, we've needed to find 3 attributes of an entity to manufacture the medicine for us. One day, Sacred Medicines may manufacture its own medicines, but right now we are partnering. We had to find a company that understood FDA, good manufacturing practices, GMP, right? And who has experience with plant medicines, as you speak to. And then thirdly, who has or could bring on a Schedule 1 DEA license. So finding those
and the other issue is that botanical medicine companies, herbal medicine companies, are not required to follow all the regulations of the Food and Drug Administration about cleanliness and so forth. So it's been very interesting. Botanical medicine companies are ill-prepared, actually, to do FDA level work. And so we finally found a lab in California that we're working with, and we're delighted.
Yes. Okay. Well, I'm going to push back on this a little bit, because not against your project, but I think we need to, as a community, we need to think about whether ayahuasca is illegal in and of itself, or whether any plant containing DMT is by definition illegal, because I submit that it isn't. And for one thing, DMT is a very common compound. It's found in thousands of plants. Obviously not all of them are used to make psychedelic preparations. Not all of them have enough DMT, but it's rather common. If you look at the genera that are known to contain DMT, like acacias, mimosas, and so on, these are large genera of plants, and probably 75% of them contain detectable or even large amounts of DMT. So this idea goes back to what we were talking about earlier, this idea that no plant should be regulated. It seems like when DMT, you can take a plant, you can make a tea out of it, like ayahuasca is. You haven't chemically modified DMT. You haven't isolated it. You haven't concentrated it. You could take chacruna, or one of the admixture plants, and purify it, put it through chromatography, get pure DMT out of it. At some point in that process, it crosses the line from something in a plant that is essentially legal under the UN Convention on Controlled Substances, which recognizes that ayahuasca is not prohibited. Any indigenous preparation containing a controlled substance is not prohibited for indigenous use anyway. But if you purify DMT from a plant, then at some point it becomes this isolated Schedule I controlled substance. So that's problematic, and the better part of valor, the cautious way to do it is to say, well, it does contain DMT. So we're going to jump through all the FDA and DEA hoops, to allow us to conduct a clinical study. But in so doing, you buy into their framework rather than push back against it, and say, well, we don't think ayahuasca is illegal. Why do we need your permission to do research on it? So, and of course, I realize that you and Victoria, you're scientists, you don't really want to get into the whole activist regulatory conversation about decriminalization and all that, but it's important to realize that is happening, and I encourage that. So potentially you could do this in a jurisdiction where sacred medicines have been declared legal on the state or municipal level. That's another way to do it. So there is that. And then the other aspect, and then I'll shut up and let you respond. But the other aspect of this that bothers me is that when you do an IND with a substance, the presumption is that it's an investigational new drug application. That's what it is. The presumption is you're going to make a pharmaceutical out of it. And I'm not sure we want to do that with ayahuasca. That's something that concerns me, because if you look at the history, particularly of the New World, of the West comes in and basically co-opts these medicines. Most of our, probably fully a third or more of our food and medicinal plants were indigenous preparations at some point. And the West took them and basically stole them. You've all heard of the Columbian Exchange. They just said, oh, thank you very much. I mean, we can point to quinine as a good example. The Europeans found quinine very beneficial for preventing malaria. Of course, this was known to the indigenous people. And, the quinine industry became a huge industry. Nothing given back to the people that preserved that knowledge. And in fact, it facilitated their dominance of these people because, otherwise malaria would have driven them out, but they shared their medicine. So this whole area of biopiracy and, indigenous property rights and all that, it's very complicated. How do you deal with that from an ethical point of view? I mean, I know that you guys are ethical. You have nothing but the best intentions, but how do you address those issues?
Let me begin by saying...
Probably not in the next half hour. But
right, definitely not. This will take a while.
I realize it's complicated.
But I'll tell you, that's a beautiful question. And by the way, I love always listening to you, Dennis, and you teach me so much. So I love your long speaking here. If Leanna and I were to answer your question, how are we not going to end up there and what are we going to give back, then I would tell you, you shouldn't believe us and it would be inadequate. That giving back is something that requires engagement of the side from whom it was taken, let's just say it that way, and the side whom is developing it and wants to figure out what to give back. And the giving back may be working together, right? The giving back may be supporting elders in these communities to teach thousands of plant medicines to young people, maybe none of which are psychedelic, right? It may be supporting community systems within the Amazon. And what do Leanna and I know about a lot of that? Not so much, but there are individuals who do, and there are resources that can be applied, or people who are brought together, or tools that are offered to help that. So how to not be a bad citizen here is something that we spend every day exploring it and talking with people, and we will receive feedback happily.
And I want to add just one thing is, let's not confuse the legality issues. Like the DEA right now considers DMT and plants that contain, and teas from plants that contain it, illegal. That is very likely, if things go the way I hope, that all natural products will be decriminalized in the United States, starting with the West Coast of the United States. So the real question is, do we need a standardized FDA-approved ayahuasca when all the people who are doing beautiful work underground come above ground, are making their own teas, or growing their own plants? And I would say no. We want those parallel pathways. And the FDA, it's like, if I want to do research on the brain effects of ayahuasca on humans, I need an FDA-approved product or an FDA waiver to do that research. That isn't going to change no matter if this were pepper, or salt in a salt shaker. If your intent is to give it as a medicine, you need to apply to the FDA to do so.
Right, and the work that you're doing to develop these standardized extracts and standardized protocols is useful, I'm not saying it's not. It definitely is useful, and even for the people outside that, outside that circle, the people that are using not really a standardized medicine, but preparing it in a traditional way, because there's always issues of quality control and all that. So if you have a methodology, perhaps where practitioners could send their samples to your lab and say, hey, can you run a profile on this? So
exactly.
That we have it will help us titrate the dose and understand, any contaminants that might be in it, because that's another thing about ayahuasca. It's not one thing. It's not, it's many things. Every ayahuasca preparation is idiosyncratic. It's often reflective of where the shaman decides to dump into the pot that day. Many plants are involved.
Right.
So
Yeah, and there's a professor in Estonia. Her first name is Helle, Helle. I forget her last name. I heard her speak at ICPR 2020 on Sunday. She assayed 102 ayahuasca samples obtained in Europe, US, and South America. And you'd be stunned by the content of those purported ayahuasca tea samples. Many do not contain what they are supposed to contain. And I leave you to pursue that. So,
and we also think that some of these terrible adverse events that have happened, that you hear about, very, very rare, are associated with contaminants in the tea. Sorry to interrupt, Victoria.
No. Such as Toei, for example, which is probably not something you want in ayahuasca, although traditionally it's added, sometimes.
But we would like to actually develop and publish some data and have the world learn about, from the Western scientific perspective, blended with indigenous healing, what real and true ayahuasca labeled with this much DMT, this much harmine, etc., does and doesn't do.
So the question is, it's all worthwhile to do. The question is then, will this put, I got two things. Reciprocity is obviously important. And I think a lot of these companies that, are venture capital funded with psilocybin, for example, they all have a moral obligation to recognize that there needs to be some give back, some reciprocity to the indigenous people that have been the stewards of this knowledge, and you're in a little different situation because you're not a funded startup company with millions of dollars in venture capital, and you don't even want to be that. But I'm just raising it here that these companies have that obligation. And then with respect to ayahuasca itself, because when I first came to Peru in 1981, there was no issue. Nobody was talking about the sustainability of ayahuasca. It was not over-harvested. It was not overused. Now it's a real problem. And so if it's available how is that going to affect that? Is that going to make it put more pressure on the resource or less pressure? Or are you going to encourage ayahuasca to, like as you're doing in Hawaii, are you going to encourage local communities to grow their own ayahuasca? And that would seem like an option, like a viable thing, provided that they're not illegal, and so this is another set of very complicated issues that need to be figured out.
Well, let me jump in and say, as we're speaking of legalization and people gaining access to the vines and the leaves, whether they grow them themselves or not, don't we get into some cultural appropriation or misappropriation, I'm never sure which word to use there, as well, by individuals who are harvesting or growing and cooking these plants? Is it just a pharmaceutical company who would want to develop these, or is it actually individuals who want to legalize these plants? And should we have a reciprocity program? I don't know. I'm really a medicine developer. But cultural appropriation of these plants leading to over harvesting is an issue, like where we are with peyote right now, right?
Yeah, I don't know. I don't know of any startup company that's really focusing on ayahuasca, because of these complex issues. It's much easier to focus on something like psilocybin because the compound can be synthesized and then you just develop it as a pharmaceutical, and of course it comes out of a sacred medicine tradition, and so it is a co-optation in some sense, but it's easier to approach within that strict framework of an FDA-approved clinical study. And and ayahuasca is not for these very same reasons. So, and then the question is how do you encourage reciprocity? One of the sort of changes in my perspective that have taken place over the last few years, I've seen the impact of ayahuasca tourism, and in some ways, it's beneficial to those communities. In other ways, it brings economic benefits and all that, but in other ways, it's very disruptive.
That's right.
So that's why I like the decriminalization ideas, because then essentially instead of taking people to the medicine, you can take the medicine to the people. That's what I would like to see is some of these centers that operate underground right now, let them come out into the open. Say, we're operating and we have relationships with indigenous people to produce and supply the medicine. And everyone benefits. And then, many people, there will still be people coming to South America to have the authentic indigenous experience or whatever, but I think it will be many fewer. And people, if they have the option to go to their, a local ayahuasca or psychedelic treatment center close to their communities, most people will do that because most people can't afford to go to South America anyway. So I think there are solutions here, and that's maybe one of them.
Yeah, agreed. I would like to see the decrim initiatives speak about reciprocity. Maybe we could learn from them as well.
Yes, absolutely.
Yeah, but Leanna and I believe that parallel paths are good. And as a colleague noted to me recently, if we also want ayahuasca medicine to be paid for by insurance, then FDA is the path to that.
Right. I'm hoping, Dennis, that sometime in the future, Medicare will cover ayahuasca group therapy. That is our ultimate goal, is to make the medicine available with trained healers administering the medicine and conducting the ceremony.
Do you think the FDA will approve of people who are not physicians?
Well, we'll have a medical doctor there who's prescribing. Okay. There will be clinical staff, Western trained, MD with the right licensure, but the ceremony itself will be conducted by someone who knows what they're doing.
Traditional, yeah. Well, this is great. I think this is actually what needs to happen, not just with ayahuasca, but with the whole issue of bringing psychedelics into mainstream medicine. We cannot bring psychedelics into mainstream medicine without completely revolutionizing it. The current approaches, the psychiatric approaches, and the economic model, right? That's right. Talk about Medicare, paying for this kind of therapy. They're not used to this. You're both doctors, right? You both know how this works. You have depression. You go to a therapist. You get 10 minutes, maybe, in front of a therapist. You walk out with a prescription. They say, take 2 of these and call me in the morning. And they mostly don't work. You can't do that with psychedelics. You have to pay for intense therapeutic time, and time is money in the way medicine is practiced. So it's very tricky,
It is tricky, but the group therapy model is low cost as well. So I looked in Medicare reimbursement manual, and Medicare does reimburse for group therapy. So when ayahuasca is FDA approved, eventually insurance companies are going to have to cover it.
Yeah, when it's FDA approved, I suppose you're right. That's the point. And a way will have to be found to do that. So,
but just to clarify, Dennis, group ceremony with an ayahuasca healer and group integration therapy after ceremony.
With a psychotherapist.
So group and group. If individuals want individual therapy, that they can do that too. But that's our plan, and we're taking it through the FDA that way.
Right. Well, I see we're. Shannon, do we get to extend this because we got a
we have a few questions. Do we want to take questions from?
Yeah, we can extend it. We can definitely take a few questions here. So the first question that's on the board so far, you kind of touched on a little bit already, but it's from Lori, and she says, will this benefit Indigenous communities monetarily that have been in deep relationship with these plant medicines? So you already talked about, giving back already to the communities, but if you want to touch on this a little bit more.
Absolutely. Yes, it will. I think monetarily is one way, but here is where this money is what we value in this world, and that isn't necessarily what Indigenous communities value. So what do the communities value? What do they want partnership with? And it really is a partnership and working together and learning
I completely agree. I think money is only part of the equation. It is definitely part of the equation, but many of these Indigenous communities, that's not a big part of their worldview. There should be economic benefits, but those benefits might not manifest as just, okay, here's cash payment. It's like,
right.
The way you do it is you talk to the communities and you say, what do you need?
Right.
Do you need good medical care? Do you need education? Right. Do you need agriculture? Do you need someone to help subsidize ayahuasca production and permaculture and all of those things, So the money is part, but the way it manifests in terms of benefiting the community may be in multiple ways, So, but I do think we, the first thing to do is engage in that conversation, that dialogue, and say, basically, we feel that your medicine that you've been the steward of has the power to heal the world. We need this. How can you share it with us? In a way that you feel good about, and the Western world feels good about, and everybody feels like it's a good thing. It's an overall benefit. So,
and the final question: and will you help us? Will you help us do this well? And can we engage you? Are you interested in engaging with us and helping us bring your medicine to the West through the highest bar, the regulatory authority?
Yeah.
Absolutely.
And the paradigm that you're proposing to shatter, which is a good thing, is the old paradigm, where you've got a traditional medicine. The pharmaceutical takes it, they develop a drug out of it, they say, thank you very much, you can go away now, and we'll just make $1 billion drug out of this. Now, I don't think that's going to happen. I certainly hope it doesn't happen with ayahuasca. And it's all about the moral compass of the people who do it. And ayahuasca can help with that because it helps teach us, everybody says, teach us how to be decent human beings.
Right.
Which, absolutely.
I'm not saying we are, but we're trying.
We're trying.
Right.
Dr. Standish, is there anything you wanted to add on that topic?
Nope.
Okay, I'll go to the next question here. It's from Carrie, and he asks, is there a concern from traditional ayahuasqueros that there is expanding use of ayahuasca in science research and for the integrated therapies of healing, including underground use, as in LA and Canada, in brackets, responsible use, FDA approval, ? What are your feelings on this, and how could this differ from psilocybin? So I can read that again if you'd like. So he's asking if there's any concern from traditional ayahuasqueros that there is expanding use of ayahuasca in science research.
Shannon? Go ahead, Dennis.
Well, I think that from that perspective, I don't think there is that much concern from practitioners, from ayahuasqueros, about the use of ayahuasca in science. I think that they would support it. Essentially they are scientists, They learn what they learn by empirically working with plants, and that's fine. And they're curious about it. And I've talked to many, and they feel like the research is valuable. We can discover things and share with them knowledge about ayahuasca that they may not have, or they may not have any way to get that knowledge. So it's a very complementary thing. Now, when it comes to the ways that it's used in an unregulated way in basements in Brooklyn and retreat centers in Maria and all this, they may have some concerns about it, But they can't control it. I don't think you can control it or really even wag their finger. I've always felt that in some ways the benefit, ayahuasca needs a vessel. It needs this ritual context in order to be effective. But the shape of the vessel can be wide as long as there is a structure. And I think the most important thing is that the people that are organizing these retreats, wherever they may be, come to it from a moral perspective, where the objective is to benefit people and not use it for nefarious purposes. And it's no different than any other spiritual technology or any other powerful thing. It can be used for good or bad. So a lot of it boils down to the ethics of the folks that are doing it. Is kind of what, and in that respect, I think the Curadero's concerns are justified, and I don't know what you do. You can help them be the educators of the wider community, and that's sort of what things like the Mckenna Academy is supposed to do, and other educational forums. Give them a chance. I want to also mention, of course, ICERS, which is one of the most important organizations. Most of you are familiar with it. Very good work that they're doing protecting ayahuasca, and Iboga is their other, the other plant medicine that they work on. ICERS.org. Have a look at that website. And an organization like ICERS may be the bridge, because they have a foot in the scientific side and also very good relationships with numerous indigenous groups, like the World Ayahuasca Forum, which happened about once every year. The last one was June of 2019 in Girona, Spain. There were 2,500 people at the World Ayahuasca Forum. So, that's an indication of how widespread the interest is. And events like that can really be useful to educate, bring all these people together, indigenous, biomedical, regulatory, government, everyone and every stakeholder, if you want to use that term, can be brought together in forums like that. And that's very good, because it's all about education, education, education.
Mm-hmm. Thank you, Dennis. Dr. Hale or Dr. Standish?
No, I have nothing to add to that. Actually, I do. Dennis, the question here is, how do traditional healers, ayahuasca healers, feel about this idea of bringing ayahuasca into scientific research? And I have, over the last 20 years, collecting my samples from ceremonies, asked. I have yet to hear anybody, any ayahuasquera or any ayahuasquera, say this is bad and you shouldn't do it. And we've been supported in our work from members of the Santo Daime Church and UDV, and I don't think there's an objection to it. The worrisome thing is doing it poorly and forgetting about reciprocity and doing that poorly. And that's why we're going very slowly and we're communicating with as many people as possible.
Yeah, that is exactly, I think you put your finger right on it. Most of these indigenous people, the indigenous healers, they know how valuable their medicine is. They treasure it, and they want to share it. They don't have the mindset that the West has.
Right.
I'll take this thing and make a lot of money out of it. They don't care about that. They do care that their medicine is respected. I think they want to see it. They want to see it spread, but it's spread in the right way. And I think, in the last 20 years, we've seen ayahuasca go from, this indigenous medicine confined to the Amazon. Now it's everywhere in the world, and it's escaped from the Amazon. And if you listen to my rants and raves, I think it's an ambassador from Gaia, and I think it's trying to send a message about what we have to do to save the planet, and that's bigger than any indigenous group. I mean, that's the wider picture is there's a co-evolutionary aspect to this thing,
And somebody, Dennis, recently said to me, enlightenment is survival at this time in the world. Enlightenment is survival, and that's why the psychedelic revolution, it's happening, it's big, it's going to change a lot in our culture, and I think largely it's a wonderful thing.
Yes, I think it's what we all hope for, and I think many people feel that it may be the only hope, but I think it's probably wrong to say that, because it encourages there are no other solutions than psychedelics, but I think psychedelics are a huge part of it, in the sense that they're catalytic. They change consciousness. Yes. And as a species, we have to change our shift. We have to understand that what's killing us and killing the planet is this estrangement from nature.
Yes.
That has happened. We've been poisoned by the Western perspective. Ayahuasca can heal that. We have to, wake up to this, and we have to wise up, and we have to start acting wisely about the crises that face us. And and it may be too late. The crises are accelerating rather rapidly. But so what do? We give in to despair? Well, that's one way you could do it. Let's just party on, or let's try to wake up. And once we've woken up, let's wise up. Let's get wise about the choices that we make. And that part of that is educating not only the psychedelic community, but beyond that.
Exactly.
And so that all of this is very encouraging, for substances that were, 5 years ago. The paradox is they're still illegal. It's like nobody cares anymore. Everyone sees that model is falling away. They should never have been illegal. And anyway, so that is, what else you got, Shannon?
Thanks for holding down the fort there, Dennis. So we have, if you guys are okay for time, we have one other question here from Kevin. And he asks, what are some of the challenges you expect to see in the process of bringing ayahuasca-assisted psychotherapy through the FDA pathway?
Well, we spoke about the challenges of plant medicine and the botanical drug development pathway. Only 2 plants have made it through, so that's one. Leanna, you raised your hand.
Yeah, I think right now the biggest challenge is that the FDA normally requires extensive animal toxicology studies to establish the lethal dose 50% for ayahuasca in mice, rats, etc. And that is morally, for me, morally abhorrent. I don't want to do it, and it's wasteful of resources. So the biggest obstacle right now is convincing the FDA that there's tons of human data out there, and we're collecting it all, and we're going to make a pitch to the FDA that there's enough human data please don't make us do that animal toxicology work. It'll cost $500,000 and it's wrong.
Right, and it's not necessary, like you say.
Right. Right.
In fact, much of the animal work has already been done in Brazil and other places.
Exactly,
Yeah,
and
it's-
FDA is a data-driven agency, so our job is to collect all the data and present it so that they can make that decision.
Yeah.
Right.
Yeah. Yeah.
Absolutely.
It seems kind of, paradoxical to insist that in order to establish the safety of ayahuasca, you have to kill a bunch of rats. I mean, what makes sense? That just doesn't make sense. It's been used for thousands of years.
Right.
And you can do the clinic, you can do examination of indigenous groups, and this has been done. It's a benefit. I keep thinking of the words that Gabor Mate once said, when he came under fire for using ayahuasca in some of his talks. He said, I don't need the FDA to tell me that ayahuasca is good medicine. No, but you may need the FDA to help you integrate it into biomedicine. That's
Correct.
a different matter.
Exactly.
Correct.
Very different.
Which
Yeah.
then would be accessible to more people in concept, at least with our world the way it is right now.
So do you guys have time for one more question? I know we're getting over time here. We'll give this last one, and then we'll have you guys say some final words here. So how can we best discern who's qualified to work with people looking to integrate this plant into their lives for healing purposes? Will making this plant accessible and regulated mean only psychiatrists or neuroscientists will be working with it?
I'm going to take a stab at that. As long as ayahuasca and other natural psychedelics are illegal in the United States, we need to have that above board thing. I don't think that having ayahuasca approved by the FDA is going to deter any of the current practices going on right now. I mean, there are hundreds of ayahuasca circles happening in major cities all over the United States.
Mm-hmm. Yeah, and they should be able to operate in the open. They should not be underground. That's the thing.
Right.
And
That's right.
that perception. And then once you can do that, then all these possibilities open up where you can work with indigenous people to produce the medicines, and that these centers utilize those, and there is a path forward to that kind of relationship. That's what I would like to see. I think that ayahuasca's healing, if you look at the indigenous context, the healings of these medicines goes on at the community level, and I look forward to a day when every community can have it's not just ayahuasca, but a psychedelic therapy center, which is not going to look like a clinic. It's going to look like a spa, right? It will offer a spectrum of holistic therapies, maybe some nutritional counseling, maybe a little yoga, massage, all of these things. A wellness center in which ayahuasca or psilocybin or whatever happens to be one of the options.
That's right.
And let's have a group ceremony room for medicines like ayahuasca and other medicines that will be given this group.
And then in the meantime, groups like MAPS is training MDMA therapists, and CIIS is training therapists, and eventually there's going to be a whole new cadre of young people who are experienced, qualified, and trained to do integration circles. And I think it's going to be really marvelous. I really look forward to seeing that.
And we really look forward to bringing the group therapy and group ceremony model forward through a regulatory agency because of the impact we all have on each other as well when we're in those circles.
Right.
So we're feeling the way. We're taking the initial steps, and I want to hand it to you, Victoria, and you, Leanna, for being brave enough to come out and and do this and take all the flack that you're taking and so on. And even people like me who are your allies, I'm your ally. I just think we have to raise these difficult questions and figure it out.
Absolutely.
We're all on the same team, and we all, believe in the efficacy of these plant medicine as well as their sacredness.
Yes.
They are gifts. They really are gifts from nature. We have to, let's not blow it this time.
Yeah. Let's not blow it. That's a good mantra.
Yeah, right.
And that's definitely something good to finish on. Did any of you have any other final words that you would like to say today before we close?
Nope.
Thank you for the opportunity.
Thank you.
Project. And to meet Dennis.
I think we wrapped it up pretty well.
Mm-hmm.
Yes.
Well,
thank all of you, and thanks Shannon for your excellent moderation. Really appreciate that.
Thank you, Dennis.
Look forward to see the discussions.
I know you held down quite a bit of it, so it's always a pleasure to have you on screen and have you here. And
I don't know when to shut up. I hope everybody else felt free to say everything they wanted to say. I can shut up if you and Leanna want to say you need some final thing.
No,
Right.
I think we said it all. And this is really good discussion. And this is, the entire psychedelic community needs to be talking about these issues.
Yes.
So thank you for giving a venue to air them out. Thank you so much.
Yeah, I think it's been a great conversation. Shout out to MAPS for making this possible. MAPS Canada.
Maps Canada.
Mm-hmm.
Right.
Well, thank you again, Dennis, Victoria, Leanna. Like I said, it's a pleasure to have you here today, and we'd love to continue this discussion sometime. Perhaps we'll have to invite you guys back and continue this. So thank you so much for the discussion and for bringing it forth. And I'm sure there's so many more questions that can be answered on this. So a big thank you to you again today.
Thank you.
Well, the dialogue continues, right? People can watch this and post questions. It's all recorded, right?
Mm-hmm, yeah. Absolutely. It's recorded, so people can just log right back in and watch it as many times as they'd like. And of course, we have all of your websites posted in the chat. So if anyone is interested in further investigation into this with Leanna, Dr. Hale, or Dr. Standish, feel free to contact them via their website, and of course the Mckenna Academy as well.
One more thing, very briefly, before we close, I would just like to acknowledge one of the loss of one of the major researchers on ayahuasca recently, and that's Dr. Jordi Riba from Spain. He has done more research on the neuroscience of ayahuasca than any other living person. He passed away a few weeks ago. Unfortunately, he passed away due to suicide. It's a tremendous loss to science. It's certainly a tremendous loss to the psychedelic community. So if you pray or whatever, send good thoughts Jordi's way. He was a pioneer, and we're all going to miss him.
Thank you for that.
So,
Thank you.
just wanted to mention that.
Mm-hmm.
Okay.
Absolutely. Well, thank you guys again.
Bye.
We'll meet again.
Thank you.
Bye-bye.
Bye.
Ciao, ciao.
Ciao, ciao. So just a few notes here before we close off for the evening. I want to thank everyone again for being here for a second episode of Examining the Psychedelic Renaissance. Our next episode will be next week with Chris Killam, and he'll be talking to us about the lotus and the vine, yoga in the psychedelic landscape. As mentioned, we do have some post-webinar sessions going, and Chris will also be hosting the first post-webinar session. So if you're interested, there will be a link right in the bio coming up shortly here. And Chris is going to be doing a 1-hour Q&A after his episode. There are about 6 spots available, and most of those might already be gone. So this is your chance to get in on that and have your intimate setting with Chris, and this will be via Zoom, so you'll be able to see him, he'll be able to see you, and I know it'll definitely be something that you don't want to miss. So thank you all again for being here. If you would like to donate to the cause, we do have a fundraiser campaign going as well, so that link will pop up in the chat. Feel free to check that out as well. A big thank you to our tech support, all of our volunteers, all of our speakers, past, present, and future. Our sponsors, as you know, this episode is sponsored by Spores Lab. So thank you, Spores Lab, for sponsoring this episode. There will be a link in the bio for them as well. And I think that's everything for this episode. So thank you so much. We'll see you again next week. Have a great night, everyone.